No doubt about it. All right. My friends, Dr. Gil is back in the house. If you're suffering pain in your neck or your lower back, pills or even surgery may seem like the only option, but it's not. Dr. Gil Kentof, I want to say it's drgil.com now. Dr. Gil Kentof is here to explain. And one thing I'd like to point out about Dr. Gil, and you've been on the show with us a lot of times before. Yes. This man has been in the same location in the Franklin area down there for 20 years with his practice. That says volumes about you. I
started when I was 12.
No, it does say a lot about the success of your practice down there. So congratulations on the 20 years down there. Now, let's talk about all the services you offer. How can you help people with back pain, neck pain?
Well, we provide a number of different services. Okay. Certainly, chiropractic care is our focus, but we also provide spinal decompression therapy, which is an excellent method of separating the vertebrae very gently and effectively to create a vacuum effect that brings fluids and nutrients back to the disc. So the disc can repair itself.
Who's this for?
So somebody that has low back pain, sciatica, degenerative disc disease, herniated disc, or ruptured disc.
Show them what's going on, because you bring these things here, and I know they look weird, but it actually shows you what's going on.
Well,
hold
if you
it
take
up
a
to the
look,
camera. Take a look.
All right. When we take a look at this spine here, this model here, we can see that this disc here is bulging outward. That represents a herniated disc or a bulging disc, which can cause pressure on the spinal nerve roots.
Right.
So what decompression therapy does is that it gently separates these vertebrae, and as it does that, it creates this vacuum effect to help draw that disc material back in position so it's no longer irritating the nerve. Blood flow and nutrients that are diffused back into the disc can help that disc heal.
So it just kind of rebuilds.
It helps to rebuild the disc, to help hydrate the disc so we can repair the damage. In this case, you see a degenerative disc where things have really worn down and dehydrated. You see how thin that disc space has become.
This is inside you, folks. This is what we're trying to tell you.
So again, as we separate these vertebrae, we're creating this negative pressure that allows these fluids and nutrients to help that area heal.
Doc, is the same thing going on with your vertebrae when it comes to your neck in a lot of cases?
Well, absolutely. It's an area that can cause pain down the arm. People can develop headaches with neck problems, and again, we use either chiropractic adjustments or spinal decompression to help that particular region heal. You see, when you're in different positions, there are different pressures on the disc.
Right.
When you're sitting, there's more pressure than any other position, about 200 millimeters. When you're standing, it's about 100.
Sure.
When you lie down on your back, the pressure is about 75.
When you say spinal decompression, though, it doesn't hurt.
No, it's very comfortable, safe, and effective. It's FDA cleared.
It didn't hurt. Well, I had it done. And it worked for me. What you do is the DRX 9000, which you're on for what, 20 or 25 minutes, something like that, and it kind of stretches you out. Now, you will certainly feel the effects once you get up. Yes. And then in the long run, the entire procedure is going to help you out.
Oh, absolutely. When you're on the machine, most people just take a nap. They kind of relax and take it easy. And they feel, a nice, gentle stretch. Here we're checking a patient, and you can see how we're doing an evaluation. Of course, we review x-rays and MRI findings to make sure a person's a good candidate for this treatment. But again, if they're having back pain and leg pain and neck pain, and they're taking medication, and a person's considering surgery, then this is a very viable option that can keep them from having that.
Let me tell you, it makes you feel good. It really, you start feeling the difference once you lie down. Once you get up, you say, oh, boy, something has been going on with me, And you feel the difference already.
Imagine all the years of compressive forces we put on our spine from sitting and lifting incorrectly and bending and twisting. Well, this does the opposite. It takes pressure off the spine, reverses that aging process of the spine by letting the body heal naturally without drugs and surgery.
You're still doing laser too, right?
We are. We're using class 4 laser, which helps energize the cells and helps not only relieve the pain and inflammation, but helps improve the healing process.
And so whatever your need, chances are you've got it. And
we have the technology to help.
And that's what I'm saying. All right. And as always, Dr. Gil puts a special for you. He'd like to say hello and introduce you to his practice down there. Here's what's the deal.
We have a great opportunity, an examination including 2 x-rays, a detailed report of findings to the patient, where we discuss all of our findings, and the first decompression treatment, all for $79. This is for the first 7 callers, and they need to call right now. The number 794-0800.
All right, so get on the list there, and then make your appointment and stop by and see Dr. Gil.
They can check us out on the web at calldrgil.com.
Got it right there.
There you go.
Telephone number, same as the one you're asked to call right now, 794-0800. And again, we point out, 20 years, same location. That's 209 South Royal Oaks Boulevard, Suite 222, Franklin, Tennessee. That's the Kmart big shopping center right there. You can't miss it. Dr. Gil, good to see you again.
Good to see you.
Take care of yourself there, my man. I feel good. Let me see you. Still ahead, serving our country can sometimes mean missing out on important family members.